Welcome back. There is a growing concern over the rise of new cases of COVID-19 infections and deaths in the country, with grade 4, class 8 and form 4 students already in school, and the reopening for the rest of the learners now remains in limbo. The numbers began to shoot up following relaxation of most containment measures. Politicians, including the president, the deputy president and other top leaders, have been on the front line of disregarding the Ministry of Health guidelines on social distancing and wearing of masks. I'm now joined by Dr. Alan Ochanji, he's the KMPDU Vice Chair. For more on the same, Doctor, many thanks for your time. When the president relaxed COVID-19 containment measures in June, there was a big call for individual and social responsibility, mask wearing, social distancing to curb the spread of COVID-19. But we've seen not just citizens, but also the top leadership, led by the president, dropping their guard on such matters, mask wearing and social distancing. What is your assessment of the level of social and individual responsibility in the to curbing the spread of COVID-19?
Thank you very much for having me. I think October has been the month where COVID has hit us the most. And I think we just got relaxed and saw things happening not in the right way. We have things that we call super spreaders. One of them you just mentioned. We've seen an increase in a lot of political activities. We've seen a lot of increase in terms of people flocking social joints. We've seen people in bars. We've seen people crisscrossing the country, both from the rural areas and also in the urban setups. And all these have contributed to the numbers. So we are at a point where the numbers keep on rising, and we are also at a point where people are not doing the things that they're supposed to do. So we are at a bad state because as the number increases, we also have healthcare workers also being affected. So I would say that we are not in a good state, and if the trend continues, we foresee a very, very chaotic and bad situation.
Measures to curb the spread, but mask wearing, we've all concluded, has not been adhered to as should. But what about other strategies, including contact tracing and quarantine, for example? Because it seems like many people are testing positive for COVID, but putting on their masks and going about their normal business. No one seems to be quarantining for 14 days.
The first people who should be called out are the politicians. You see, the analogy here is very simple. You go out for a political rally, you spread the disease to the community, the burden increases. That means those people have to go to the hospitals. The capacity of the hospital is stretched. It means even the healthcare workers working there are also overstretched. Right now we are talking at a point where we have up to over 1,400 healthcare workers affected. We've already had up to 18 deaths. In fact, as we are talking to you, we just lost a senior colleague in Kakamega, a senior orthopedic surgeon to COVID. So even the healthcare workers are not spared in this pandemic. And we cannot sit down as healthcare workers and tolerate indiscipline in the political class. Because as we are talking to you, we only have up to about 300 ICU beds in the country. Now, if we continue with the trend of not obeying the public safety and healthcare measures, we are staring at a situation where, one, you will fall sick and you will not have anywhere to go. And two, even if you get the chance of going to the hospital, you might not be attended to. Because the people who are supposed to attend to you, perhaps they're in isolation, some of them might succumb, and the numbers might not just match. You have a very big population that is sick, and you have and you have a very small population of doctors that are supposed to take care of you. So we must call out the political class to stop this, what I would call nonsense, and stick to the public health rules that govern COVID.
As per county distribution, with the latest numbers, major urban areas like Nairobi, Nakuru and Kiambu are leading in these statistics. And of course, we've seen other countries in Europe especially impose stricter measures to curb the spread of this resurgence of COVID-19. From where you stand, do we need to bring down, to bring back cessation of movement in major urban areas?
We must be candid and we must be very decisive. I hope the president, when he'll be talking to the nation, he must be candid and tell people that we cannot continue doing the same things and expect that the disease burden will go down. We must be candid and stop some of these things that are going on. First of all, I've talked about the political gatherings. The second thing is we also have to look at the whole thing of opening bars and restaurants and where people are gathering. And the third thing, we also have to look at when we're going to the churches, are we obeying the laid down regulation? Mm-hmm. The other thing that we must look at very decisively is how we deal with the healthcare workers. I'll give you an example. Right now, as we are talking to you, you've mentioned the epicenters being the urban areas like Nairobi, the Nakuru. Right now we're seeing Eldoret. In the capital city where Nairobi is, we have healthcare workers who are on strike right now. And why are they on strike? It's because they don't have comprehensive medical cover. So you answer me, you are expected to be a frontline healthcare workers. But the same government this is supposed to work for cannot even guarantee your protection. How are you going to work and protect other people if your life is already at danger? In Kirinyaga, for example, we have cases being reported there. The administration there sacked all their doctors. How do you expect that country to handle COVID if they can't handle their healthcare workers? So even as we look at containment measures, the first thing that we need to look at is individual discipline. But then the second thing, the government must be disciplined enough to take care of the healthcare workers who are supposed to be taking care of the whole public. Muranga, for example, you have a 30-bed ICU hospital, but you don't even have an anesthesiologist. So you wonder, is it just a bed or is it a functional bed with a proper human resource that comes with it? So we must be very calculative and very decisive.
We have the president, of course, holding that meeting on the 4th of November owing to the number of COVID-19 infections and deaths. Borrowing from what you just said, what would you like the president and the county governments to take into consideration while figuring out the next way forward?
Sorry, I didn't get you to come up again.
What would you like the president and the county governors to address as they lay down measures to curb this resurgence of COVID-19?
One is to make sure that the increased political activities, they must come to a stop. If they don't come to a stop, then we might just decide as healthcare workers to stay at home, because we cannot risk our lives over things that Kenyans can avoid. Kenyans must have respect and they must have discipline. And politicians, for example, they must take leadership and protect the whole country by not going ahead with the political gatherings. The second thing the president must do is to prioritize the welfare of healthcare workers. It's immoral, it's bad to talk about healthcare workers expected to work without medical insurance. Our colleague who departed in Kakamega, for example, he died in a private hospital. Why? Because the county hospital where he's working for was not ready to take care of him when he was unwell. So we must be able to talk about how do we provide comprehensive healthcare, medical insurance for the healthcare workers. How do we take care of their bills? If I got COVID today, for example, God forbid, I will have to take care of my own bill. The government does not provide for my medical bills and does not even provide for compensation. So as the president talks, we also expect him to talk about the plight of healthcare workers. And then three, we must have a way of at least making sure that the gatherings we're seeing in the bars and the social gatherings are also contained. Otherwise, if we continue with the trend, the numbers will continue rising, more people will continue succumbing,